Picture this. It's 6:47 in the morning. Your alarm hasn't rung yet, but something has woken you up anyway. Not noise, not pain, not a bad dream, just your mouth. It feels as if you swallowed a handful of chalk dust sometime around 3 a.m., and nobody told you. Your tongue is practically glued to the roof of your mouth. Your lips feel like they belong to someone who just crossed a desert. And you think again, if that scene sounds familiar, I need you to stay with me for the next few minutes, because what most people assume is just one of those annoying little things that comes with getting older is actually your body trying to hand you a very specific warning note, and most people never read it. Today, I'm going to read it with you, line by line. I'm Dr. Franklin, and if you're new here, this channel exists for one reason: to give adults over 60 the kind of clear, honest, research-backed health information that too often gets glossed over in a 7-minute doctor's appointment. We don't do fear here, we don't do clickbait. What we do is connect the dots between everyday symptoms that seem minor and the bigger health picture underneath them. And today's dot connecting exercise, it starts in your mouth, but it absolutely does not end there. Before we dive in, hit that subscribe button if you haven't already, because next week we're covering something that genuinely shocked me when I reviewed the data. A specific combination of two very common supplements that may actually be robbing your body of one critical nutrient instead of helping it. You're going to want to catch that one. But right now, dry mouth. Let's talk about what's really going on. Here's something most people don't know about saliva. It is not just spit. Your body produces somewhere between 1 and 1.5 liters of saliva every single day. It coats your teeth like armor. It neutralizes the acids that cause tooth decay. It carries enzymes that start breaking down your food before it even reaches your stomach. It contains antibacterial compounds that actively fight infection in your mouth and throat. Saliva is in many ways a first line of defense for your entire body. So when you wake up every single morning and that defense system has essentially gone offline overnight, that is not a trivial thing to brush off. Now here's the part that changes how you think about this permanently. A landmark study published in the journal Oral Diseases found that among adults over 65, chronic morning dry mouth, what the medical world calls xerostomia, was present in nearly half of participants. Nearly half. But here's the finding buried inside that statistic that most people never hear about. In over 80% of those cases, the dry mouth was a downstream symptom of something else entirely, not the problem, the signal. Think about the difference between a smoke detector going off and a fire. The smoke detector is not the emergency. It's the announcement of one. Waking up with a dry mouth every morning is your body's smoke detector. And today we're going to figure out which fire it might be pointing to. There are 5 primary causes I want to walk you through. And I'll tell you right now, at least one of them is probably going to make you stop and think, wait, that might actually be me. Before we get into this, take a moment to say hello in the comments. Tell me your name and where you're watching from. I read every comment, and I'd love to know who I'm helping today. All right? 'Cause number 1, the medication puzzle. The number 1 culprit behind morning dry mouth in adults over 60 is one that almost nobody suspects at first. It's not a disease. It's not a deficiency. It's the medication sitting in your medicine cabinet right now. Here's a number that should genuinely stop you in your tracks. More than 400 prescription and over-the-counter combined carry dry mouth as a documented side effect. 500. We're talking about blood pressure. Medications, particularly the class called diuretics. We're talking about antihistamines, the allergy pills millions of seniors take every single spring. We're talking about antidepressants, overactive bladder medications, certain pain relievers, and even some over-the-counter sleep aids that seem completely harmless. Each of these medications on their own might cause mild dryness. But here's the catch that most people, and honestly even some doctors, miss. When you combine 3 or more of these medications at once, the dry mouth effect doesn't just add up. Research published in Gerodontology found that the combination effect of multiple medications compounds significantly. Seniors taking 5 or more daily medications showed nearly twice the rate of significant dry mouth compared to those taking 2 or fewer. And the average American over 65 takes how many daily prescriptions? between 4 and 5, plus supplements. I had a patient, let's call him Gerald, retired, postal worker, 71 years old, meticulous about his health. Gerald had been dealing with severe morning dry mouth for almost 2 years. He'd seen his dentist 3 times about increasing cavities that seemed to come out of nowhere. He was using every oral rinse on the shelf. When he came to see me, I asked him to bring every bottle from his medicine cabinet. We lined them up on the table. 6 prescriptions, 3 supplements, 2 over-the-counter products he used regularly. Within that lineup, I found 4 items known to reduce saliva production. Not 1, 4. We worked with his prescribing physician to adjust the timing of 2 of those medications, not even the dosage, just when he took them. Within 3 weeks, Gerald told me his morning dry mouth had gone from a 9 out of 10 to a 3 out of 10. No new prescription, no fancy treatment, just connecting the dots. Here's your action step for this one. Write down every single medication and supplement you take, including things like melatonin, ibuprofen, and antihistamines. Bring that list to your next appointment and ask your pharmacist specifically, could the combination of anything on this list be affecting my saliva production? Pharmacists are extraordinarily knowledgeable about drug interactions and side effects, and this conversation is free. Cause number 2, the silent nighttime thief. Now, I need you to pay very close attention here because this second cause affects tens of millions of Americans, and research consistently shows that the majority of people who have it have absolutely no idea. We're talking about obstructive sleep apnea. Here's the simple version of what happens when sleep apnea occurs. The soft tissue at the back of your throat collapses partially or fully while you're asleep. Your airway gets blocked. Your brain sends a panic signal. Your body jolts, gasps, or shifts just enough to reopen the airway. And then you fall back into sleep. Most people never consciously wake up during these episodes. They have no memory of it in the morning. But here's the connection to dry mouth that most people never make. When your airway is blocked, your body does what it has to do. It defaults to breathing through your mouth. Mouth breathing across an entire night evaporates saliva at a rate that nasal breathing simply doesn't. You wake up with a mouth that feels like it hosted a wind tunnel all night long. But the dry mouth is again the least of the concerns here. Research from the American Heart Association has found that untreated sleep apnea in adults over 60 significantly elevates the risk of stroke, irregular heart rhythms, and cardiovascular events. A separate analysis published in the Journal of Clinical Sleep Medicine found that seniors with undiagnosed moderate to severe sleep apnea had measurably higher rates of cognitive decline over a 5-year follow-up period. So, if your body is waking you up with a dry mouth every morning and the underlying cause happens to be sleep apnea, that dry mouth isn't the story, it's the table of contents. How do you know if this applies to you? Ask yourself these questions honestly. Do you snore? Have you ever been told you snore loudly? Or that your breathing sounds strange during sleep? Do you wake up exhausted even after what should have been a full night of sleep? Do you have unexplained morning headaches? Do you find yourself falling asleep in chairs and waiting rooms during calm afternoon moments when you really shouldn't be tired? Any combination of these alongside morning dry mouth should absolutely prompt a conversation with your doctor about a sleep study. And here's the good news. Modern home sleep studies are done with a small device you wear on your wrist and fingertip. No hospital, no wires, no overnight clinic stay. Many Medicare plans cover this fully. It's worth one phone call to find out. If you're still here with me and finding this helpful, take a moment to type 2 in the comments. It lets me know you're watching and getting value from this. Because number 3, the blood sugar connection. Let's talk about blood sugar. Specifically, I want to talk about the people who have a problem with their blood sugar and don't know it yet. According to the CDC, approximately 38 million Americans currently have diabetes. And here's the part that should make every senior pause. Nearly 1 in 4 of them remains undiagnosed. That means millions of people are walking around right now with elevated blood sugar levels causing real measurable damage to their bodies without a single diagnosis on their chart. Here's how elevated blood sugar and dry mouth connect. When blood glucose levels are consistently high, your kidneys go into overdrive trying to filter and flush out the excess sugar. To do that efficiently, they pull fluid from other tissues throughout your body. This creates a kind of slow systemic dehydration, and one of the most noticeable places that dehydration shows up is in saliva production. An NIH-backed analysis found that among people with poorly managed type 2 diabetes, persistent dry mouth was one of the most commonly reported daily symptoms. And in many cases, the dry mouth had been present for a year or more before the diabetes diagnosis was even made. Your mouth was warning you. Nobody connected the dots. I want to be very direct with you here. If your morning dry mouth comes with any of these other signs, you're urinating more frequently than usual, especially at night. You feel unusual fatigue that doesn't improve with rest. You've noticed cuts or small wounds taking longer to heal than they used to. Your vision occasionally seems blurry in a way it didn't used to. Do not wait for your next routine physical. Call your doctor this week and ask for a fasting glucose test and an HbA1c. The HbA1c gives your doctor a 3-month window into your blood sugar average. It takes less than 5 minutes to draw. It can catch something you're dry. Mouth has been trying to tell you for months. Cause number 4, the dehydration deception. This fourth cause is one that surprises people because of how simple it sounds, but the biology behind it is genuinely fascinating and important. Chronic dehydration. Now, before you say, I drink plenty of water, hear me out, because hydration in adults over 65 works differently than it did when you were 40. Here's what happens as we age. The hypothalamus, the part of your brain responsible for signaling thirst, becomes progressively less sensitive. The research on this is consistent and well established. A study published in the Journal of Physiology demonstrated that older adults can reach fluid deficits of 2% or more of their body weight without experiencing meaningful thirst signals. In plain language, your body can be genuinely running low on water and it simply won't tell you the way it used to. Meanwhile, your kidneys become less efficient at conserving water as you age. Your skin loses moisture more readily. And if you're taking diuretics for blood pressure, which we already talked about, you're losing even more fluid than your peers who aren't. The result is a population of older adults who are quietly dehydrated through most of every day, and the only outward sign they might notice is that sticky dry mouth every single morning when they wake up. The practical fix here is one of the simplest on this entire list. Stop waiting to feel thirsty. That signal is no longer reliable. Instead, build hydration into your day the same way you take your medications, by the clock, not by feeling. Aim for a minimum of 6 to 8 glasses of water spread across your waking hours. Set reminders on your phone or keep a water bottle in every room you spend regular time in. And take note, caffeinated beverages and alcohol don't count toward this total. They actively accelerate fluid loss. If this opened your eyes, share it with someone over 60 who keeps waking up with a dry mouth and thinks it's just normal aging. Most people have no idea their body stops signaling thirst properly, and a simple like helps this reach more people who need to hear it before dehydration becomes a bigger problem. Cause number 5, the overlooked autoimmune condition. The 5th cause is one that generates more undiagnosed cases than almost any condition I discuss on this channel. And if you're a woman over 55 watching this right now, I want you to pay especially close attention. Sjogren syndrome, spelled Sjogren, is an autoimmune condition in which your own immune system mistakenly attacks the glands responsible for producing moisture. Specifically, the salivary glands and the lacrimal glands, which are the glands that produce tears. The result is a body that gradually loses its ability to keep itself lubricated. The mouth becomes persistently dry. The eyes become dry, gritty, and irritated. Joints can ache. Fatigue can become disproportionate and unrelenting. Now, here's why this condition belongs on this list. 90% of Sjogren's diagnoses occur in women. The average age of diagnosis is the late 50s to early 60s. And studies published by the Sjogren's Foundation estimate that it takes the average patient between 2.5 and nearly 5 years from symptom onset to receive a correct diagnosis, largely because the primary symptoms are dismissed as normal aging. Dry mouth. Oh, that's just getting older. Dry eyes? Try some drops. Fatigue? Well, you're not 30 anymore. If those phrases sound familiar, if your morning dry mouth consistently comes paired with dry, irritated eyes, joint pain that doesn't have a clear explanation, or fatigue that seems wildly out of proportion to what you're actually doing, please bring up Sjogren syndrome by name at your next appointment. A simple blood test can screen for it, and knowing about it changes how it's managed completely. The complete action plan. All right, let's bring all of this together into something you can actually do starting today. Step 1. Conduct your medication review. List every prescription, every supplement, every over-the-counter product you use regularly. Bring the physical list, not just your memory, to your pharmacist or physician, and ask specifically about the impact on saliva production. You may be surprised by what a single conversation reveals. Step 2. Assess your sleep honestly. For 1 week, track 3 things each morning: whether your mouth was open or closed when you woke up, whether you feel rested or still exhausted, and ask your sleeping partner, if you have one, to note any loud snoring or pauses in breathing. If a pattern emerges, request a sleep study referral. Most are now done at home and are covered by major insurance plans. Step 3. Don't skip the blood sugar test. If you haven't had a fasting glucose and HbA1c run in the past 12 months, schedule it this week. This is especially important if you have any of the other symptoms I mentioned alongside the dry mouth. Step 4. Restructure your hydration. 8 glasses minimum spread across the day by schedule rather than by thirst. Keep a log for 2 weeks. Your body will respond faster than you expect. Step 5. Get immediate nighttime relief while you investigate the root cause. Look for oral rinses or gels containing xylitol, such as Biotin Dry Mouth Oral Rinse or Acti Dry Mouth Rinse. Use them immediately before sleep each night. Critically, avoid any mouthwash containing alcohol, which will make the dryness significantly worse. Xylitol-based products do double duty. They moisturize and they protect your teeth from the bacterial overgrowth that dry mouth enables. One important note: if you are currently on blood thinners, lithium or ACE inhibitors, please speak with your doctor before making significant changes to your daily fluid intake. Hydration levels affect how those medications behave, and your doctor will want to know. And one urgent note: if your dry mouth comes alongside difficulty swallowing, pain, white patches inside your mouth, or unexplained weight loss, please see your physician promptly rather than waiting for a routine appointment. These combinations warrant prompt evaluation. Here's what I want you to take away from everything we just covered. Morning dry mouth is common, but common is not the same as normal, and it is absolutely not the same as harmless. Whether it's your medications interacting in ways nobody told you about, a sleep condition that's been quietly working against your heart and your brain while you sleep, blood sugar that's been creeping upward without symptoms loud enough to hear, or an autoimmune condition that has been dismissed as aging, every single one of those things can be identified. Every single one of them can be addressed. You came here with a symptom. You're leaving with a map. Now, I want to hear from you. Drop one word in the comments below. Type sleep if you suspect nighttime breathing might be your culprit. Type meds if you're going to have the medication conversation with your doctor or pharmacist. Type testing if you're booking a blood sugar test this week. I read every single comment, and what you share genuinely guides what we cover next. If this gave you something your last doctor's appointment didn't, please subscribe, because next week we're pulling back the curtain on a specific warning sign that a very common cholesterol medication may be doing more harm than good in certain adults over 60. It's a topic that gets a lot of questions and deserves a real thorough answer. I'm Dr. Franklin. Take good care of yourself this week. You've already taken one important step by being here. If this helped you, share it with someone who needs it. You might do them more good than you realize.